Okay, so we're here with this lovely young lady who had some surgery a while back, and unfortunately, apparently has damaged her medial plantar nerve. And unfortunately, it seems the nerve tried to regrow and form some sort of neuroma in the area, and has had chronic pain with a history of RSD as well, multiple injections, and just no relief. So, what does that mean? What does that mean to you as far as being able to do anything?
I cannot walk for any period of time. There's always discomfort there. When I drive a car, it's especially bad. I can't exercise, do anything on my feet. There's only one type of shoe I can wear. It's a tennis shoe with a lot of space for the toes. So it's impacted my life dramatically.
And you went out and visited UCLA clinic, the pain clinic out there, and they treated you with testing and other things?
Yes, and they confirmed the RSD.
Yep. And this was how long ago?
And this was, I think, in 2011.
Okay. And you say you take Cymbalta.
I do.
What's your pain level on Cymbalta and what's it off Cymbalta from 0 to 10?
When I am on the Cymbalta, I'm probably a 4 or 5.
Okay.
On a normal day. I've been on my foot a lot. It spikes up there to like an 8 or 9.
Okay.
When I wasn't on the Cymbalta and I tried to walk, it was up there like a 10. It was...
Okay. Let's circle over here. Get behind me so you can see the foot. So here is the incision line where there was a prior surgery. Where they attempted to go after the nerve for nerve entrapment in this region. And when I tap on her, she starts to get a little tingling right about here in the medial plantar nerve, and it radiates up into this area here. I did check her tarsal tunnel, and she doesn't have any symptoms there.
No, I feel a little discomfort. I could feel it shooting into the toes.
Okay, so she can feel that, so we'll probably have to maybe not deal with that. Just the 3 toes on the inside, or the ones on all of them when I do this?
When you do that, it's the first 2 toes.
Okay, so we probably don't have to mess with that. That may be an option in the future, but I doubt it. So right now I'm going to give her an injection in the medial plantar nerve, and we'll see. Okay, so I just injected you in your foot, and how did that? And I asked you to step on it and see how it felt. What percentage of your pain that you were having would you say is gone from that injection alone, and what's left?
90%.
Okay. Is there anything residual that's hanging in there, or?
On the inside of this toe.
Yep. Still feel a little stinging?
I still feel.
What does it feel like?
If I touch it here,
yep, it
runs right down here.
Okay. So 90% of your pain is gone now. Yes. They've injected you with that.
Right.
Now, if you had to live with that pain that you have right now, you're good?
I'm good.
Okay.
Then you wear high heels.
We're now 3 weeks after surgery with Catherine here, and I'm just going to touch some areas. Close your eyes for me. Any pain or discomfort when I touch there?
No.
Any pain or discomfort when I touch here?
No.
How about here?
I don't even know you're touching anything.
That's what I like to hear. So this is where she had all of her pain last time prior to surgery, right over that scar, which I don't know if you can see there, but here's the incision, very nicely healed. This is numb, right?
No, I feel that.
You feel that a little bit, but this is numb.
I feel that.
Okay, but no pain if I press in here?
No.
No pain here?
No.
Okay.
I feel that when you press it.
So you haven't really had any pain after the surgery so far, and now you can move your toes and everything's going pretty well.
Right.
All right, so now it's time to start walking soon. So we're back now with Kathy, who's now about a month after surgery?
Yes.
Okay. And so prior to surgery, she could not move her toes without significant pain in any of the toes, and especially these 2 toes. Whenever she moved them or touched them, they hurt. Go ahead and do that now. Does that bother you at all? Are you having any indication, any pain when you do that at all?
No.
None?
No.
0?
0.
Okay, and before that would give you what kind of pain?
Serious pain in the first 2 toes.
Okay. And also, you told me that for the first time in how long you were able to actually put on a heel?
Yes.
How long? When was the last time you could put on a heel on without pain? When was that?
15 years ago. Very sad.
And now? You did it, and you had no.
I did not have pain in the ball of my foot or in my first 2 toes.
Okay, so everything's progressing along. The only thing she's experiencing now is she is still getting some phantom pain in the other digits because the nerve graft that we put into the foot here is still growing into itself and hasn't quite burned itself out yet. So we have to kind of put the reins on you a little bit and tell you, you know, I know you're excited that everything's going well and you're able to walk, you know, without that excruciating pain you had before, right?
Yes, and I can drive, which is really unusual because I couldn't drive before without a lot of pain in these toes.
Okay, so what we're going to do is just institute some therapy at this point as far as aqua therapy. We'll let you do a little bit, but we really don't want you pounding on this yet because we want that graft to kind of take. But you're able to sleep through the night now, no problem, and
No problem.
And everything's going well.
Mm-hmm.